Hey, everybody. Thank you guys for being here. I'm getting everything ready to go. So welcome to the Art of Healing with your host, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. So thank you, Dr. Judy, for being on the show today.
Oh, my pleasure, Matt, as always. And I'm really excited about this topic of how people contribute to their pets' illnesses, because I think it's really important and just so overlooked in a lot of cases.
I mean, when we started the show today, you had talked about some clients that have come in and they'd share that, and we're talking about anxiety. And we're talking about, and I love how you say that as individuals, we can start to perpetuate some of this. And so you were talking about some clients that had come in that really were looking for something wrong with their pet. And deep down, you're like, there's really nothing wrong with your dog. So where do you see this kind of infiltrate into treatment protocol, and where you start to see this and you see the dog start to experience anxiety or display it?
Well, first of all, what I see with a lot of people that, you know, sort of, how do I want to say this, react to every little thing that the dog does. And I get that some people aren't as sure about making judgment calls. Do I take my dog in? Do I not take my dog in? But come on, if your dog sneezes or coughs a couple times and they're otherwise acting perfectly fine, you don't have to be running them in to the vet. And I think that's really stressful on the dog. Every time, they go into the vet, they're getting medications, which can contribute to more long-term illness because it impacts the gut. And sometimes they're put on prescription diets and all these things we've talked about on the show that are not healthy. And of course, the pet parent is concerned if they're taking that step to take their pet into, say the ER on the weekend. The dogs, they pick up on your emotions like big time. And you just have to realize that if you're anxious and worried, your dog is picking up on that, and they don't even know what they're supposed to be anxious or worried about, but it affects them. So, the whole thing about the negative effects of stress is that we stay in the sympathetic mode, that fight or flight mode, rather than engaging the parasympathetic nervous system, which is the rest and digest nervous system, where that's where the body heals. If you're in sympathetic, always worried, always, running from the metaphorical tiger, your body can't heal. And if you're anxious, you're making your dog anxious. You're keeping your dog also in that in that sympathetic mode, and they're not going to heal. And they don't even know what they're anxious about. They just know you're anxious, and then they're anxious because if you're worried, then they figure they need to be worried about something.
You bring up a really good point. If you're worried, your dog doesn't really understand or comprehend why you're not worried. So it's probably always on defense at some point going, oh, is this going to happen? And then it translates over to that sympathetic side. And we know that when the adrenals are being triggered, we're actually affecting the immune system and how your dog is healing and how your dog is feeling better. And if it constantly is in a state of that sympathetic stress mode, it's going to cause other illnesses down the road. As we know, epigenetically, our thoughts will and our feelings will, or the stimulus from the outside, either internal or external, will start to affect our health and start to change our genetic structure.
Right. And even affects that, that stress affects our gut, affects the microbiome. I know in people, they're actually identifying certain strains of bacteria that people with more anxiety tend to have larger populations of. So
Yeah.
just, and then it perpetuates itself. So if you're anxious,
Mhm.
you can cause some of these bacteria to grow, and then more of them grow, and that helps keep you anxious. So you kind of get in this vicious cycle, and
Yeah.
you have to do the things to relax you. It's not about taking a probiotic or something like that. You have to start meditating, going for walks, getting out in nature. And you know what? Those are great things for your dog too. Well, training your dog to meditate might be hard, but they would probably lay there with you. My dogs hang
They
out with
do.
me when I meditate, because
Yep.
it's calm. They love just
Yes.
that time of just calm, like there's nothing going on, we can just all relax. And then of course they
Right.
love to go for walks and all of these other stress reducers. They're good
Mhm.
for us. They're also good for the dogs. And so it's
Yeah.
just really important to think about how your energy, if you're living a hectic lifestyle, and even being home now, we've talked about this has
Yeah.
been stressful for a lot of families. You got, people are home on top of each other. They're not
Mm.
used to that. And so it's a very different dynamic. So you
Mhm.
have to remember to do these things to help reduce your own stress, and it will actually help keep your pets healthier.
Yeah, and you had mentioned it is like in that moment of meditation, because like when I meditated this morning, Leo immediately sits on my feet and he
Hmm.
comes over and he lays where normally a dog that has just that dog, we should have named him anxiety because he's always just amped up. Like, who do I need to go? Where do I need to go do? Like, always has a mission. But when I slow down, he almost gets the permission to slow down himself. And it feels good. I mean, it
Hmm.
feels good to go for a walk. I mean, even for us, we're like, oh, we got to go for another walk. But if we flipped it and thought, oh, I get to go for a walk with my dog and enjoy those little things and slow down a little bit, yeah, I think you're allowing your dog to slow down and not be in anxiety. So when pet parents come into your clinic and they're amped up looking for something wrong, oh, they've got a sniffle, they have this, or they have diarrhea, and you ask them the questions, how often do they have diarrhea? And they're like, oh, every once in a while. But because we have anxiety, do you think that translates? And we're talking about this a little bit today, is that translating over to the pet parent's anxiety and to the pet's anxiety. So with that, how do you help a pet parent get past that point of that anxiety? That, oh, there's got to be something wrong, Dr. Judy. He's doing this or she's doing this today.
I think, a lot of it is education, education about what's normal for a dog. Dogs throw up sometimes. Dogs don't eat every meal. When dogs don't feel good,
Mhm.
they might skip a meal. And that's actually can be the best thing for their body, because they
Yeah.
know, like, dogs are scavengers, they're out eating stuff, So
Right.
say they eat something that doesn't agree with them, well, they throw it up, which that's a good thing. And then
Mhm.
they let their gut rest. So they might skip a meal. And if
Yeah.
people, do the knee jerk and rush their dog into the vet or into the ER, and then they're put on more medications, and then there's
Yeah.
more stress, and all the dog wants to do is go curl up and sleep for the day, and then they'll be fine.
Mhm.
I'm like the other end of the spectrum with my dogs. Like,
Mhm.
oh, they didn't eat, yeah, threw up, well, I'll give it a day or two. Like,
Yeah.
because I know that things cycle. And I think people get in this mindset, well, I took the dog in, we went in, got this medicine, and the dog got
Mhm.
better. Well, guess what? 95+% of the time, they were going to get better anyway. They just let the
Mhm.
body heal. So I think part of it is educating people about what's normal for dogs. Dogs are going to have soft stools sometimes. It's okay.
Yeah.
It's not that you completely ignore it, but again, that can be a purging. They ate something that didn't agree with them, so they're
Mhm.
kicking it out of their body, or it's a sign that maybe we need to tweak the diet a little bit. Then whatever you're feeding them is not appropriate. Or maybe they snuck into the kids' Cheerios or something. And dogs always get into things we're not aware of. And anybody that says that they know exactly what their dog's doing 24/7 is kidding themselves. Like they don't know what
Right.
their dog's doing every second of
I
the
hope you
day.
don't. Yeah, you're letting your dog be a dog. But you make a really good point, and I love how you said if you notice your dog, throws up, hasn't eaten for a day, you give it a day or two to allow the dog to rebalance itself and to really get out what its upset stomach. And so if we want to humanize our pets, because I think that's a lot of what we do in today's day and age, is we humanize them. Oh, our dog should be eating this. Oh, they need to be eating this because we eat it and it makes us feel better. So you know what? That's natural. Our dog should be eating that as well. So going into those pieces is giving it that couple days. So I know when I'm sick, I don't want to eat for a couple days. I may sit and go to sleep and just lay there and go, oh man, I feel terrible. Well, the last thing I want to do is go eat a meal and go,
Right. Or
fill
go to the
everything.
doctor.
Yes. No, I'll wait a couple days before I go see the doctor.
Like,
Yeah.
I don't feel good. Do you want to go sit in the ER for 3 hours when you got a stomach ache?
No.
No, you want to go curl up in bed and just
Right.
sleep it off, right?
Exactly. And you give it the time to heal. Well, your dog's the same. Your dog may have gotten in, and I love they're scavengers. Yeah. You know what? If you leave the pantry open, your dog, if something falls, is going to be like, oh my gosh, heaven just dropped from the sky. And I'm going to eat everything that hit the ground. And so that's just what they do. And naturally, they may eat something that doesn't agree with them. So allowing them to have diarrhea, it's almost like their way, or vomiting is their way of cleansing, is getting it out of their system so that they can get back to normal again and go through. So when a dog is having this, or we're worried about a dog being sick, how many days would you typically wait before you're like, yeah, I should do some blood tests on my own dog?
Yeah, so that's a great question. And I actually went through this with one of my little Chihuahuas a month or so ago. So my dogs are older. I know, we're getting to where, we could hit the downturn because they're both over 14, just like your little Chihuahua
Yeah.
is. And Wiley was having these episodes where he would like just stop, like freeze, and he'd kind of shake, and it was like he didn't want to move. And this would happen sometimes after he ate, and he wasn't vomiting or anything, but I really couldn't figure it out. So I'll usually give 72 hours.
Okay.
If they're drinking. So if a dog can go several days without eating. Now,
True.
you might want to, I would say if a dog goes more than 3 days without eating, you definitely want to be getting them checked. But in that time, they do still need to be drinking water and staying hydrated. So
Yes.
I did end up doing blood work on Wiley, and that all checked out okay, but he was still having these odd episodes, and then all of a sudden they went away. So I'm not sure. I'm not sure what it was. I actually suspect that he loves to chew on these tendons, and I do see him sometimes swallow like a little bigger piece.
Yeah.
That makes me a little nervous, and I just wonder if he had something like that kind of stuck in his like lower esophagus or upper GI tract somewhere, and something was sitting there and just wasn't moving through, and then all of a sudden it moved through. That was my theory, because if that type of thing had persisted, or I had a client where that type of thing was persisting, I would probably at some point recommend imaging, do some x-rays or an ultrasound, see what's going on. I'm a big proponent of chiropractic care. So if it was pain or back pain, we would get a adjustment done. So I look at, are they, staying hydrated for one? Are they peeing and pooping? Are they like able to move around? So if a dog like completely quits moving, like can't get up
Yeah.
or just doesn't want to do anything, that's
Mhm.
pretty severe. I mean, that
Mhm.
might be worth taking them in, especially if it
Yeah.
goes beyond 24 hours, where they're just really lethargic, or repetitive vomiting. So there's levels, right? All
Mhm.
dogs are going to vomit occasionally. If your dog is vomiting 8 or 10 times a day, that's serious. That could be a blockage, and
Mhm.
blockages are really painful. Or if your dog is, passing, profuse bloody diarrhea,
Mm.
that's more serious,
Yeah.
as opposed to, well, my dog's had some, loose stools for a few days, or my dog, vomited and didn't eat breakfast this morning,
Okay.
but still wanted to go for its walk. Those type of things. I mean, there are levels of severity where you would want to take your dog in. I mean, there are
Mhm.
sometimes true emergencies. I don't want people to think that they shouldn't ever take their dog in, but for these occasional symptoms,
Mhm.
a lot of this stuff is just normal. It's normal dog stuff.
Yeah. And that's a great point is, and I kind of think, when Leo has issues, I think about ancestrally. So if he was wild, how would this treat? So if he's moving slow, just not eating, but he's still able to walk with the pack, so to speak, and go through that. And so if he's still able to walk with the pack, and he's just not eating, and he's not going through those moments, and he's still able to go out with me and go do some things, I'm less concerned that if he's got diarrhea, as long as it's not bloody stools or he's not vomiting, like you said, 8 times a day, I'm gonna just watch it. I'm gonna be like, all right, I'm gonna just keep an eye on this and really watch it over that 2 to 3 day period of time. But thinking about how our dogs really are and how they would be in the wild, because they are really only 150 years away from being wild. I mean, dogs that did not just go sit on the couch at home 150 years ago. No, they were outside. They did all this
Yeah.
stuff. They scavenged. They ate food that we threw down on the ground. And I know evolution does not happen that fast. So our dogs did not evolve that quickly over the last 150 years to be able to deal with that. It's just when we, as humans, and we started to give them more and more and bring them into our specific tribes, is when we started to humanize them and give them kibble, which is terrible. And I'm sorry, since you feed your dogs raw, Dr. Judy, you probably got another good 5 years with them, probably,
Yeah,
with
I
everything
know.
that you're doing, because
I
you're
know.
feeding them so well. And so with all of that is, and sadly, my Chihuahua, well, happily, my Chihuahua is going to bite me for the next 5 years, which
Yeah.
I'm totally happy with. So with all of those pieces, I know I'm doing everything right for them, not me. I'm doing stuff that's right for them. So my anxiety started to come down a little bit in regards to, oh, is this right? And started to feel here and knowing that I was doing everything right. And as as a family, we know we're doing everything right for our dogs because they're healthy. They go through moments, like you said, they're scavengers, but really ultimately we are doing things right for our pets by allowing them to just be a dog.
Be a dog. And I've had clients over the years that or have been in like farming or ranching for
Mhm.
generations, and they'd come into me and they'd say, you know what, we don't ever take our dogs to the vet unless they get like run over by a tractor and break their leg or something. They don't get vaccinated. They
No.
eat scraps. They eat the family
Mhm.
leftovers. You talk
Yeah.
to farming and ranching, probably is still the case
Mhm.
today. Their dogs eat a lot of scraps. They eat the leftovers. They give them, they give all
Yeah.
that all that stuff to the dog. And barring an accident, um, those dogs were living to be 18, 20 years old.
Yeah.
And kibble's only been around since World War II, so about
Mhm.
80 years. And like
Yep.
you said, that is not this whole thing about, oh, dogs have adapted to eating it. That's a bunch of bunk.
Yeah.
Evolution does not happen in 80 years. Their digestive systems are still meant to eat a fresh food, meat-based diet.
Exactly. I mean, to take a look at the report from the dog that lived to be 30, I think that dog was 31 years old when it finally did pass away, but it was on a farm in Australia. And they asked the farmer, what does your dog eat? And he goes, I don't know, what it can find. And it was
Right.
drinking raw milk. It was eating meat. It was eating the placenta out of the cow, like at the afterbirth, like anything that was available. The dog was a scavenger. And this dog, just I think it was like an Australian Shepherd style breed, just lived for that long because it was left alone to be a dog.
Yeah, to be a dog and eat all this stuff that is people,
Mhm.
we think is really gross, but there's a lot of nutrition. I mean, how much
Yeah,
nutrition do you think is in a placenta that's been supporting a life
life,
for months? It's a ton
right.
of nutrition,
Oh,
in that. And so dogs know that. They're like, wow, bonus,
yeah, I made both my dogs food last night. Now, granted, I get it from the same supplier you get yours, but we did tripe. And if
Mhm.
anybody watching the show has ever done tripe before, that is true love. That is when you know you love your pets so much, is when you will cut up tripe and give it to them, because it smells
It's awful.
terrible. It's awful. And so, but a fresh green tripe is what they eat. And both of them thought it was heaven this morning when we fed them. Is they said, "Oh my gosh,
Mhm.
this is everything I want." When literally, if you put my nose to that, I would I would throw up. Like, it
Yeah.
is that bad. So that's right. As a human, I think it's terrible. But my dog takes a look at it and goes, "Oh, that's all. It's the superfood that they need to eat, all that phytonutrients and everything
Mm.
that is in tripe." So when we look at these pieces, if I was worried about them, or if I showed anxiety, oh my gosh, you can't eat that, and I let that come into it, would both of my dogs essentially look at it and start to turn their nose up to it? Because I was extremely worried about it, and I was worried about feeding raw. With a lot of the work that we do here at Parsley Pet, I'll have individuals contact me and say, so how long should I cook this meal for? I'm like, well, you really don't need to cook it at all, as long
No,
as
not
you
at all.
follow good like storage practices, have kept it in the fridge, didn't let it sit out for 3 days, like stuff like that.
Yeah.
Going at it from logical side, they can eat it raw, because the last thing I know, your dog's not out in the field catching a rabbit and then building a fire and then roasting that rabbit on the spigot.
They can't build fires without opposable thumbs.
No, these
It's
things are amazing. Yeah.
yeah. Well, and I think, a real important thing for people to remember too is dogs are dogs, like they're not people in dog suits. And so we
Mhm.
anthropomorphize, right? Which
Yeah.
means we think our dog should eat what we want, and they're going to like to eat the stuff that we like. And if it
Mhm.
doesn't smell good to us, then it's not going to be good for them. Well, dogs eat poop. Like, how
Yes,
bad does it have to get?
right.
They're out there eating goose poop and bunny poop and deer poop, and
Yeah.
it's all okay. Maybe that's their dose of probiotics for the day.
Mhm.
Dogs do stuff that people think is really gross, but
Yeah,
it's okay. And then people are, I hear this, people are worried. My dog ate goose poop. My dog ate this. My dog ate that. Like,
right.
their dogs are a much greater risk of disease from other dogs, not from all
Mhm.
these other species that they're interacting with out there,
Right.
because most diseases are pretty species specific, meaning
Mhm.
that they're going to be transmitted dog to dog, not rabbit to dog or squirrel to dog, or
Right.
there's some things like rabies,
Mhm.
all mammals can get it, but for the most part, dogs out there picking stuff up, eating poop from these different species, you know roadkill, all kinds of stuff like that. Dogs,
Yeah.
they're when they're healthy, their bodies can handle that. So
Mhm.
relax a little. Let your dog
Yeah.
be a dog.
And I think that's a great summary for the show as we end it, is that it's really is in those moments is take a deep breath and say, you know what? my dog ultimately is healthy because they are showing these signs, and they're showing signs of being healthy. Their tail is wagging. They're excited to see you. They're not curled up in a ball and been sleeping for the last 3 days. They're really healthy. And so by us calming down, we allow them to calm down as well and heal.
Yeah,
So
and then the people are healthier too. It
yeah.
helps everybody be healthier.
Amen. And this is it. This is why we do this show, is we want all you guys to be healthy. Whether you're a canine listening to the show today, or you're a human listening to the show going, oh, how can I do this better? And sometimes slowing down and just taking that break to knowing, you know what, you are doing everything great. If you're not starting to feed raw yet and you start experimenting with raw feeding, that's wonderful. That's a great step to start getting your dog as healthy as it can be.
Mm-hmm.
So thank you, Dr. Judy, for the show today. I so love this topic, and I wish you the best, and I wish Wiley
Yeah.
the best as well, as getting healthy and living an incredible old Chihuahua life.
Yeah, he's, moving a little slower, but he's hanging in there back to just being an old dog. So
That's it.
we're on a roll again.
That's right. You can go back to being Wiley.
That's right. That's right.
All right. So we'll see you guys all later, and thank you again, Dr. Judy.
Oh, you're welcome, Matt.
We'll
Take
see you.
care, everybody.